Hi, my name is Julian, and my role for this project is the Minister of Health of Bosnia and Herzegovina, BiH. Health expenditure in BiH occupies about 9% of its GDP. Around 30% is privately funded, and 99% of private spending is on out-of-pocket payment, OOP, which is the direct payment paid by patient to providers. The bar chart shows the OOP level in BiH is much higher than the EU average and neighboring countries like Croatia and Slovenia. OOP made up 29% of providers' revenue, mostly in hospitals, with the largest share spent on medical equipment and treatment services, as the bar chart tells. One key cause of such high OOP expense is the weak enforcement of co-payment policy. And just to clarify, OOP is paid at full prices, while co-payment is a fixed proportion of the treatment costs paid by patient to hospitals. And high OOP will cause financial hardship, undermine affordability, and encourage corruption. My focus is on SDG 3.8, emphasizing universal health coverage, financial protection, and affordable medicine. Then, I propose a three-step reform. Firstly, mandate insurance enrollment for all citizens and register them through the national ID system, aiming for 90% coverage. Second, mandate a 10% structural co-payment, which goes directly to the insurance fund and is later reimbursed to providers. Low-income groups are exempt. Lastly, regulates and limits OOP spending. OOP is banned for primary care and is permitted only for high-cost care like surgery. Moreover, all payment must come with itemized bills. This step will have to achieve the previous two steps. And my goal is to shift more financial burden to public sources and limit OOP. Therefore, reduce private spending from 30% to 25%, with 10% as co-payment and 15% as OOP. To maintain hospital revenue, we need an increase in public funding by 5% of the total health expenditure, which is roughly 107 million US dollar, calculated from its GDP. Also, we need to hire 20 officers for OOP supervision. The general salary is $8,000 per month per person, so in 1 year it is 2 million. We also need $500,000 per year for software development and maintenance of the co-payment system. Therefore, total funding in 5 years is 466 million euros, which has been confirmed by the economy minister. Looking back on SDG 3.8, for the target of universal health coverage, we have 90% insurance coverage by 2030. For the goal of financial protection, we reduce private and OOP spending. For the goal of affordable medicine, we cut OOP costs on medical goods. Thank you.